Welcome, everyone. Thank you for joining. We've got an exciting webinar for today. Our topic, we're going to be talking about optimizing healthcare staffing, cost, scalability, process efficiency, all the good information around healthcare staffing contingent workforce programs. I am Laura Moritz, Director of Implementation for Flentis and your moderator for today's webinar. I'm here with our guest, Sarah Olguin, VP of Travel Healthcare at LoyalSource. Thank you for joining us, Sarah. And of course, Eric Coppin, Head of Sales here at Flentis. So want to kind of call out a few things before we jump right into the topics. We've got a live Q&A at the end of this. So if you guys have any questions, please chat them, comment them. We'll be taking those at the end. Sarah, Eric, and occasionally myself will be answering some questions. All right. So Eric, I'll have you just do a quick intro of who you are. I know you do this every time we do a webinar, but let's give the audience a quick intro for you, and then we'll go to Sarah.
Sure. Thank you, Laura. I appreciate it. So Eric Coppin here. I run global sales for Flentis. I've been in the contingent workforce space for about 25 years in both technology and managed services, and really look forward to talking a lot about healthcare today, something I'm very, very passionate about.
Perfect. Sarah, over to you.
Sure. So thanks everyone for joining us today. I've been in contingent workforce for the last 17 years, specializing in healthcare, and just excited to talk with you. We do manage travel healthcare as well as state and local entities.
Perfect. All right. So I'm super excited to have both of you guys here to talk about contingent workforce programs specifically relating to healthcare. I think it is very different in a lot of ways from other programs. And so I think just kind of touching on some of those differences throughout today will be really helpful. And I want to kick off our conversation by just, Sarah, talking to you first about what are kind of some specific tools or strategies that can be used by clients to help streamline processes, budget planning that may be specific to healthcare?
Certainly. Thank you for asking. So really, I'd say with a partnership of having an MSP and a software like Flentis, there's four main areas that are kind of at the disposal of a client like this. So there's spend analytics, predictive spend analytics, operational, and workforce. Being able to have that data readily available and make decisions in real time off of that is really kind of what makes that decision point. Sometimes you have to look at the size of an organization if it's eligible for something like these type of services, but really there's many that do qualify because they have ongoing needs. What I've seen clients do is look at that past spend data and decide on things that they don't want to repeat. And then they can take a look at the predictive spend, looking at positions. If we were to fill this, this is what we would spend. And then to make decisions on where they want to minimize cost.
Perfect. Eric, anything you want to add on to that?
The only thing I'd add on to that is, we know that having a number of conversations with some pretty large health system CFOs that, there's been some significant cost creep, not even post-pandemic. It started before the pandemic. I think the pandemic did two things. It exacerbated it, but also it really shone a light on exactly how much money, these health systems are spending in labor. I'm hearing across the board, it's well exceeded 50% of total budget for a lot of CFOs. So when you're really looking at the data, you want two sides to it, right? I think it's very important that the client has real-time view into what they're spending, how they're spending, the approval process, making sure that has not been sidestepped, and and is standardized as well. So everybody's got eyes on the budgeting, but also the purview from the supplier. Being able to really look in and see what they're doing at the program, how they can be better, how they're ranked, where they sit in the pecking order. I mean, we want the suppliers to have as much information as the clients, because I think that serves everybody much better. But Sarah's completely right. We make decisions based on data. If you don't have a clear purview into your data, then you're flying blind, and those days need to be over with. I mean, because that is the foundation of a contingent workforce program, is visibility. And there's a lot we can be doing different as contingent workforce program providers. But it all starts with visibility into what you're really spending and how you're spending your money.
Mm-hmm. Just to add on to that, Laura, just briefly, is, we've seen a lot of clients where they're, to Eric's point, they're trying to combine all of this data manually from all these sources. They're doing VLOOKUPs in Excel, trying to put these together. And it's such a lengthy process where, in this case, when you have a system prepared with dashboards and reporting that's, doing it in real time, it's always there and available. You don't have to wait, or that's also spending that time, having a team member spend that time to do it. Just one other piece to it too is on the front end. That's really once it's already live. One way that they can do that is sometimes you have organizations that operate differently at all the different regions or locations, depending on how they're broken up. And one really important step in the process is doing that due diligence up front to kind of consider how sometimes it's really hard for clients where they feel like they have to change their process for technology. Really what we want to do is slow it down and figure out, how do we make the technology enhance the process that they already like, and hopefully replace some things that are manual.
Mm-hmm.
I think that's a really interesting point, and both of you kind of touched on analytics and having the correct and appropriate data, what actually needs to be available in order to make these decisions. But I think something that we hear often in the industry is questions, concerns, just lack of understanding around scalability. And I think that's a piece that is maybe holding people back from implementing these types of programs, or expanding a program that already exists. So can you guys kind of just touch on key factors that affect the scalability of a program, or the ease of that scalability?
One thing I can say, and I know that Eric will have things to add from a software perspective, but one thing, just to blanket statement out there, is oftentimes when we talk to clients about scaling their program, there's just this automatic connotation that scalability means they're spending more money. And that is absolutely not the case. I think when we talk about scalability, it's looking at the areas where they're already spending in contingent workforce, and how do you get those to be in one place with a standardized process to make it easy for those that are administrating and looking at the process all the way around. So whether it's HR, whether it's compliance, IT, onboarding, having the ability to have a consistent process is key. What we've seen from many organizations is that, for example, in the healthcare setting, your mind automatically goes to hospitals. Many hospitals will onboard just the clinical piece in inpatient to their program, but they leave out some of the non-clinical or even outpatient centers like imaging and all those outpatient clinics. And they'll even go as far as to have their own team do staffing kind of on that per diem basis, or have their own float pool. We want to find ways that they can bring them into the system so that they have that tracking and visibility across the board for all of those different settings, as well as that team, but not come at a premium that they're like, well, I don't want to make that decision because it's going to cost me more than the way I'm doing it today. What we're trying to enable is transparency and that decision making. So that scalability actually means you're leaner and efficient with the program.
Mm-hmm. Mm-hmm. Yeah, and when I also hear scalability, I think of a couple other things as well. It's not just jurisdictional, right? Where we've got multiple centers and clinics and outpatient centers, ambulatory, et cetera, but also worker type, right? I think oftentimes in healthcare, when we look at managed services, non-clinical is often forgotten, right? Or the program is separated, which it doesn't need to be. It really doesn't need to be. And I think it's really important that a lot of staffing leaders and procurement leaders, when they're thinking about a contingent workforce program, you can and very easily can get all of your spend into one umbrella, right? If you're running your program office correctly, whether it be internal or using a third-party provider like LoyalSource, if you think about contingent workforce, a lot of the rules are very, very much the same. In fact, I would argue non-clinical has fewer barriers to success in terms of process and procedure, right? So that's one aspect I think that is forgotten when you talk about scalability. The other part of scalability is just your value-added services, right? So I mean, you think specifically around your typical contingent staffing, whether it be IT folks or clinicians, but what are you doing in terms of independent contractors, right? So we know that you utilize a lot of independent contractors in healthcare. You got PRNs, NPs, PAs, nurse anesthetists. It goes on and on and on. So how are you vetting these folks? Who's your agency of record, and who's holding the defense file? From a compliance aspect, that's huge. But from a cost aspect, what is your cost? Do you have set markups? Because these are corp to corp relationships. So how are your vendors managing this? But also, what are they charging you? This is something that really needs to be looked at, because I think there's a big delta between how commercial contingent workforce programs, if you think the Fortune 500, manage this aspect of business versus healthcare. And I've seen a lot of big healthcare systems not even manage it. And that's millions of dollars in spend and potentially millions in dollars in taxes and fines. So it's something that's very, very important when you're talking about scalability, is what else can you do? Whether it be AOR, EOR, direct sourcing, supply and rate intelligence, there's a whole world of value-added services that are being done in these types of programs in the commercial world. Why haven't we seen them really pick their head up in healthcare? I mean, I've got my own feelings about that, but we need to start doing that. We need to start bringing these types of things in, because what's going to happen is it's going to expand your capabilities of adding talent supply to your organization, but it's also going to create new opportunities for cost mitigation and cost savings.
And that kind of actually leads into the next topic that I was going to go to anyway. So perfect segue, Eric. I think in what you touched on there about the supplier being able to have that transparency, supplier performance, supplier rates, all of that, I have just a couple of questions to follow up on the supplier piece of these programs. The first one for you, Sarah, is kind of how do you approach, given that transparency and the interaction that the suppliers are going to have with the program, how do you approach the relationships with them and making sure that you have quality suppliers and a diverse supply base?
Yeah, thank you. So I think there's a couple of things to talk about in the course program. One is you have a lot of records on the board positions, so you need to fill them. Some cases we've seen things evident that it just, one of the ways that we're going to a little bit differently is really just less look at suppliers and more value differentiated to kind of to really understand their performance, their engagement. And one thing I particularly like our partnership with Flentis in the system is there is a decline requisition button that exists for the suppliers to see. And we explain to them this is not counting against any type of their scorecarding or performance. But what it allows us to do is typically, we don't want that hope and wait when it comes to managing a program. It really takes somebody to kind of quarterback which teams are focused on what recs. And that includes sometimes your own recruitment sources. Like at LoyalSource, we have a vast recruitment team, but we also have a number of suppliers. And that reporting gives us the ability to understand how many of our suppliers are not interested in specific recs so that we can pivot resources or continue to source for them. Really using that data to highly perform on the program versus kind of hope and wait that this vast majority is going to send in for all of the different requisitions. Aside from that, LoyalSource, while I manage the travel, healthcare, state, and local, LoyalSource is actually best known for all of our federal programs where we support our nation, in all 50 states and in some cases internationally. And we see those as well that are kind of in need of these types of programs that can provide that data and use diverse suppliers. Many times these programs require a set of diverse suppliers to be part of our network. So we've already built that up from our federal programs and are excited to share when we look at state and local as well as commercial.
Awesome. And Eric, just to kind of follow up on something that you said earlier about the supplier performance analytics, we're talking a lot about how this benefits the client and that they have all this insight into metrics that they maybe didn't have before, ways to measure these suppliers. What are the ways that the suppliers actually benefit themselves from being a part of these programs and having the analytics on their side that you talked about?
Well, yeah, I mean, if it's done right, the technology is done right, the supplier should have real-time view into exactly what's going on at the client, right? I think where there's been some challenges in healthcare is, you have a lot of quasi VMSs, partial VMSs, more requisition automation than true full scale VMS providers sitting in between MSPs and clients. And sometimes suppliers are kind of left holding the bag. They don't know what the status of the requisitions are, the status of their submittals, right? And that grows frustration. And when you have suppliers that are frustrated and feeling like they're left in the dark, they don't want to support the client anymore, right? That's very important because one of the big things we hear all the time is, I've got an MSP, they're probably a vendor positive MSP, meaning they're filling the recs too. But after they get a swing at the plate, we don't know what happens. We don't know who it goes to. We don't know if they're responding. We don't have any visibility. And from the supplier standpoint, it's the same way. And it's even more frustrating for them because then they get the feeling of, hey, are these guys holding recs and then only releasing after weeks of getting it? They need to see what the actual opportunity is when it became open. And then they also need to see every step of the way if their folks are getting looked at, if they're being rejected, what's the reason? Because if you give them the information, the suppliers will adjust, right? If they feel like they're truly part of the program. If they're just shooting into the dark, it's only a matter of time before you lose that supplier and you got to go out and find another one. And then you're just rinsing and repeating, right? So, visibility and transparency is really, really important. And it has to be, it has to be standardized from the client all the way down to the final tier of the supplier. So everybody understands their expectations and supports accordingly. And there also has to be incentives, right? If someone's doing a really good job at a tier 2, what's the incentive to get to the tier 1? You want them to be a tier 1 because that means they're working harder and they're putting more resources into supporting your program. So, the supplier aspect, sometimes people don't think about it in contingent workforce. They think about the client, they think about the MSP. You need to really be pro supplier in these programs because, again, that's where your talent's coming from. So everybody needs to know what's going on and be involved in the entire process.
One thing I'll add, Laura, about Flentis that I think is really outstanding is just that no stakeholder is kind of left behind. As Eric said, a lot of times there's this, of course, we all have this huge emphasis on what does the client need to see, what does the MSP need to run the program. But what we're seeing in the supplier view, they have their own login. It's not just the traditional, let me see the recs, let me see the offers and where my candidates are. You've had the ability to build out dashboards and things that are unique to that supplier, their own float pool, so that they can prepare things to be ready when positions come available. All of those, I think, are a value add that are not seen with just every single platform.
Yeah, and I think this is a really important point too, and I want to kind of tie together things that each of you had said. And Sarah, when you first spoke about the less is more concept with suppliers, I think that's a really important point to tie in with what Eric is saying about their participation and buy-in with the program. I think that less is more method allows you to have that relationship with the suppliers to say, hey, like, we really value you here. We don't have 100 suppliers in this program. You are one of our trusted suppliers, and we want to build that relationship and improve that scorecard that we have with you, so we can see that relationship improve. So I think we've also kind of talked a lot about data. Suppliers have data, clients have data, MSP has data. I'm curious to hear kind of both of your takes, and I'll start with you, Eric, on the being using that data. How is it actually turned into a decision that's made by the stakeholders of the program? I know we offer dashboards, we offer reports, but I think sometimes it's, okay, now what do I actually do with that information?
Mm-hmm. Mm-hmm. Well, I like to hone in on two areas that are, I think, most specific. And one is supplier performance and the other one is cost, right? So first, with supplier performance, what you're going to be able to do with the data is understand what facilities are being serviced correctly, what departments are being serviced directly, correctly rather, and where there's voids, right? Where are we not getting enough staff? Where are we, hurting? These things are going to highlight successes. This is kind of like the green, yellow, red light. Green, everything's great. Yellow, we've got a little trouble here with attrition, or fail to start, or we're not getting enough candidates. And then your red area where we're dying. We're not getting people. We're not, people aren't getting submitted. Is it the location? Is it the bill rate? So supplier performance is going to be huge, because we're going to very quickly be able to see, okay, where are deficiencies inside the program, and whether it's worker type or jurisdictional. And then we can employ different types of solutions that will, again, support those gaps. But you can't make those decisions without the data, right? So the platform is going to be able to highlight those things, and then they can go back to their program office or MSP and say, okay, here's where we're having problems. What can we do to mitigate these problems and quickly provide a solution? All right, so that's one. And then the cost aspect is very simple. Especially with, say you've got 6 months or a year of data that's in the platform, what your ebb and flow is by department. You understand what areas are most critical within your staffing organization. And you're going to be able to very quickly and noticeably get ahead of any seasonality, like, for example, flu season, which we're in right now. And get that information to your suppliers or to your direct sourcing provider or your internal staffing office, et cetera, and say, look, guys, we know that in 1 month things are going to really pick up, and we're going to need, to grow that talent pool. We're going to need to essentially create not only some travel requisitioning, but supplement it with some per diem requisitioning. Let's get ahead of it. So, your data is going to be able to get you to the point where you're going to be ahead, and everything's going to be preventative versus reactionary, right? And that's what you really want, right? Is what can I do to support that? Now, from the cost perspective, again, we can say, okay, we know that travel nurses or long-term contract allied health professionals can be somewhat expensive. Why are they expensive? Maybe it's because we're bringing them out. Maybe we need to start creating local talent pools, right? Where folks can start picking up shifts, or maybe we need to do more in direct sourcing where, we are self-sourcing candidates, alumni, part-timers to help supplement all of our staffing, right? So that's going to, have lower bill rates involved. So, again, the data is what makes the difference. And then you can start being proactive and building out your staffing strategy, your sourcing strategy, right? Your compliance strategy, all these different things ahead of time. So you're not reacting. When you react, especially in healthcare, you're in big trouble because everybody needs help. It's a game of inches, and you want to stay ahead of the game as much as possible. So data, again, is the foundation of the program. So that's my 2 cents.
Perfect. And I would echo everything that Eric said, but I'd also just kind of a word of caution, because I've seen it so many times that there are some organizations I've seen do a great job trying to manage things without a software. But the pieces that, even at the most organized teams, what you're missing is that step-by-step change in occurrence data. So when it went from one stage to the next stage and the following stage, it is very challenging to manage a program and determine, are you having the challenges from the time that you released a requisition to submittal, or is it once we get the submittal to actually getting feedback to that candidate for interview? That is extremely challenging to do without something that can create a timestamp, like a system like Flentis. So that is a big piece, I think, what's missing for those that try to kind of venture on their own and not take advantage of what's available. But I think the other pieces are just kind of what we were talking about earlier with suppliers. I think every supplier across the nation has recruiting managers that are grading these requisitions. And when there's an overrun of suppliers, sometimes there's less of a focus. They'll grade that particular requisition lower. So being able to have the data, even for the supplier, to see, okay, we're getting maybe we're one of 3 that are working on this versus one of 30. So the data can actually work in the favor of promoting just that visibility and focus as well.
Mm-hmm.
So I think, kind of, first of all, those were both great answers, and I think that's one of the things that is the most important piece about a program, is making decisions and having that data in order to make the decisions. So I'm curious, when we talk about system functionality or program operations, are there any changes or enhancements that are, Sarah, especially from the MSP side, that you are planning to implement or have implemented recently with any specific clients, or any kind of best practices that you're working towards? And I think where I'm going with this, one that comes to mind is we recently worked together on an implementation, and we kind of reevaluated the invoicing process, and I'm just kind of wondering if you can speak to how changes like that really affect the program and the health of that program and those processes. I think we might have lost Sarah.
I think we lost Sarah.
We lost Sarah.
Either that or she was unimpressed with your question, Laura.
It could be either one, to be honest with you.
She'll be back.
No, I'm sure she will join. Oh, she's back.
There, did Perfect. It reconnect? Sorry about that. I did hear the first part of your question about Perfect. Just enhancements and one of the recent ones we did. I think we might be thinking about the same thing, because there's a lot of good things that we built into the most recent go live, but there's a particular thing I think that stands out for me, and that is anyone that's ever worked in contingent workforce with suppliers has understood that sometimes, of course, nothing usually stays final. So sometimes there's changes, right? To somebody forgot to clock in after lunch or something else on the timesheet. And unfortunately, it sometimes gets all the way to the invoice stage before that is reconciled. And that can be a challenging process. It's not a fun one to go back through and try to level set all the way around. So one of, I think that the standout thing for me in the most recent was that we've built a view where suppliers can see that import of time data on a weekly basis and approve on the front end, making sure it matches what they receive from their contingent worker. And then as the MSP, we can see a preview of all the things that have been approved. If it looks right to us, we can push that forward. The client gets to see it in draft, send it back if there's something that looks amiss. And then anything that, all the pieces they think are fine, don't have to wait on that edit. They get to move forward and can be finalized for approval. So I think that's a huge win in terms of just where the state of VMSs have been for so long, where you're just kind of static with that. And it's really a testament to the type of partnership that you get at Flentis with just customized, custom items that you might need. I feel like that word is often overused. Oh, we're willing to customize for you. But many times I've seen too often where it's more of a white labeled change of, hey, we put your logo on it. We put all your facilities in or your cost centers and shifts, but the functionality is static and there's not a roadmap to adapt to how an organization or even an MSP partner might need to work. So I think that one was a standout item, and really looking at for future customizations for other clients, I think could include something similar of a process that might necessitate just a different view or custom items on a workflow.
Yeah, and I think that's from a product development perspective, we really lean on those partnerships as well, like with LoyalSource, the knowledge, the insight that you and your team have, Sarah, to be able to tell us, how do programs actually operate? I think there's a lot of pieces that get missed in the technology that end up having to be communicated via email or have to have workarounds for it. And so I think that's a huge piece of our partnership with you guys, as well as getting that knowledge and how you guys are actually running your program.
I did want to add on a little bit to that. I wanted to just kind of make a more general statement, because I think sometimes the message gets lost in the healthcare industry. VMS isn't here to support the MSP, period. It's a system of record for everything contingent workforce, anything external labor, right? So when you think about what a VMS's role should be, it's okay to be a little selfish if you're a client. These programs are built for you. And I would love to see the clients in healthcare take a little bit more ownership and be a little bit more bullish about what they want and how they want things. I think oftentimes, and I've seen it working in the healthcare space for many years, there's a selection of a partner, and then they just kind of hand it off to the partner and let it go until things don't work well. And you can't do that. The VMS also has changed significantly since its inception decades ago. And I think where Flentis has really put a lot of time in R&D is being that agile platform, right? That is nimble, can integrate and be highly configurable and move on the fly. Not trying to be everything to everyone, but have the capability to fit into multitude of different tech stacks and client back office systems. That's where the changes have been, right? And you should utilize that to the best of your ability within your organization, because today the technology is so much more advanced than it used to be, just 20 years ago. And in healthcare, it's been a really, really slow churn. So there's just so much more out there. And I'm really excited to continue to have a lot of more conversations with healthcare leaders and what the capabilities are, because it's vast and it has changed very, very rapidly.
So I think that's a really interesting point, and I kind of want to get your perspective here, Sarah, on the piece of client processes are changing constantly, and sometimes that does leave programs like an external workforce program left behind and not up to date. And how does an MSP navigate that to make sure that they're staying in lockstep with that client along the way?
Yeah, I think a big part of it is just mapping how the software and the program processes complement everything that's being done within the client's organization. So here's what we have for our current program. Here's where all of how these fields in the system and these functionalities and workflows complement what the business process is. If there were to be new locations added, an acquisition takes place, or just a change in operational process, then you really do need to kind of take that pause and see, okay, how do we iterate what we've already built to match that? And then aside from just keeping up with operational change, it's also that continued enhancement of how do we continue to make everyone that touches the systems job a little bit easier. So if we are noticing patterns of how our clients work, how an account manager over the account needs to see certain things, or even supplier feedback, it's taking that and seeing how can we make minor adjustments so that they can come out in the next sprint of updates, and ultimately just continue to make that process smoother. Because there's so many times where I've talked to people where, sometimes they say technology is our worst enemy. They feel like it's just slowed down the process. And that was never the intention for a program or a VMS. And so it really takes just that thoughtful mentality to sit down and think about the amount of work it's going to take for each stakeholder to action their piece of the puzzle, and make sure that we're setting it up in a way that feels natural to the user and can be, expanded.
Yeah, I think both of you made very good points there, and that the MSP and the technology are here to enhance, provide best practices, help, but that the client really has to play an active role in telling you what are those current processes, how does their operational processes change over time, or what are they currently, what is their end goal with that. So I think the three of those working together is super important.
Yeah. And you know what, Laura, really quickly,
Yeah.
what's really interesting, and I think it needs to be stated, is, we'll talk to organizations that have had legacy VMS technologies in their enterprise for a very, very long time, and very dated technologies that haven't been updated in years and years. And they're thinking, oh my God, it's going to be a real pain to rip this out and put something new in, and then we got to train everybody, blah, 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 blah. It is actually easier to stand up a new VMS technology in healthcare than it is to do a Gen 1, because you have to remember, you already have the data. You've got your approval trees, you've got your GL codes, your cost centers, the reports that you want, your standardized process. And guess what? All your data is already in a centralized repository. For an organization like Flentis, you've just done like 65% of the work. So what we can do is come in, create a sandbox, right? Set up the new platform, talk to you about what kind of enhancements you want, do a data dump, do the test on the site, and then we can roll out in a phased approach, and the client will not be disrupted one bit. And it actually goes quicker. The implementation goes quicker. So my message to the world is, hey, listen, the pain is really not there in switching something out. If you do it right, it's very seamless and non-disruptive to your general contingent workforce program. And what you'll find is very shortly, you'll have a new opening of all kinds of different value-added services by just upgrading that piece alone.
And again, you're reading my mind today, Eric.
Mm-hmm.
Because that, no, that is great. Makes my job way easier. But that's exactly where we're going. I think we're talking about a lot of things of the data and who's involved in these programs. But one thing we haven't touched on yet is, to your point, Eric, of it being a Gen 1 program or transitioning from a current platform that they're already using, is who is a good candidate for these types of programs? Who are we looking at that we say, okay, you probably should have some kind of contingent workforce program in place? I think that's a really important thing to kind of distinguish with our audience as well, is what do I need to be thinking about? Okay, I check these 3, 5, 7 boxes. I should probably be looking into a program. And I kind of want to hear from both of you on this piece.
Mm-hmm. Do you want me to start, Sarah, or do you want to start?
Sure, go ahead and start.
Okay, well, I'll take the first swing at the plate. So, yeah, I mean, I think I mentioned one, right? You've got a program that might be stale. You've got an old, dated technology. Obviously, if you've got pain in terms of fulfillment, these are all things where you might want to take a step back and say, okay, what am I doing right? What am I not doing? Are you capturing everything, right? Are you getting non-clinical and clinical? Are you getting the ICs as well as the W-2s? What are you doing in terms of intelligence around rates and supply? Do you have a talent pool? Who's creating your talent pool? I mean, these are all questions you need to be asking when you're making decisions, right? But I will tell you this: if you have at least $5 million in your program, you should have a technology just to make your life easier. You got to think about all the administrivia that goes around managing staffing. You don't want your folks, HR, TA, procurement, nursing. You don't want them spending too much time in the staffing process. So whatever you can do to automate, standardize, and alleviate a lot of that burden is going to be to your benefit. And then as that spend tranche goes up, then you got to start asking yourself, do you have internal program management capabilities? Because there is bandwidth, right? And you do need people that are focused on this to keep your program evolving in the right direction, not getting stale. So do you need at a certain spend level to bring in an expert like a LoyalSource to help manage your program? And I want to say too, be smart about what your program goals are. What are you trying to improve? What are you trying to achieve? And let your partner work with you to achieve those, and then hold them to that standard. So those are my 2 cents. What do you think, Sarah?
Yeah, I would say, in addition to kind of what you've already shared, really just being able to kind of pause and look at what are all the pieces that you want to include in your program. When you think about your process on the daily basis, I'll talk about a couple of the different personas that are in high need of these types of services, both the program side as well as Flentis. Really, the first one that comes to mind is like HR talent acquisition. These poor people are going and sending out mass emails and trying to track down. They're having to keep a separate log, whether that's Excel or SharePoint or however they've designed it, Smartsheet. They've heard all kinds of things of how people are tracking the recs, the contingent recs that they're getting from their internal hiring managers. Now, then they're going to Outlook and they're emailing all of the people that they're contracted with. What's also challenging about that is these contracts may not all be at the same rate. So somebody's having to keep track of that. Then you're looking into your inbox, seeing all of the submittals come back through. It's just a really cumbersome process that doesn't have to be that way. And I think one of the biggest things that I tell clients is you're going to, with the model, the way that it's built out in cost is when you look at an MSP with a Flentis partnership, you're going to have the same price model as you do for regular staff augmentation. It is a supplier funded model typically. So I ask people, why would you maybe choose that path of having to do all of those steps and struggle with lack of reporting, and then also struggle with tracking compliance when essentially you're kind of comparing side by side? These are the same price to your organization. And I get a lot of questions sometimes about suppliers. Well, our suppliers are often able to look at not just the needs of one client, but across our whole vendor partnership. So many are happy to join us because they're also seeing kind of a win-win of other programs they may have the option to across the country. So I really look at it that way, is having people kind of pause and see all the things that they're doing manually, and at a zero cost switch, what's holding you back.
Perfect. And I think we're coming up to 10 minutes left. So I just want to remind everyone, if you have any questions, please submit them. We're going to do one more question for Sarah and Eric, and then we'll jump into the Q&A. So let's see, where's my... so this is kind of a fun little thing that we like to do at the end of our webinars. The last question is just like one little piece of advice, bit of information for the folks that may be listening that are thinking about implementing a program. What is kind of your one recommendation? If you could pick one thing, what would you tell them? We'll start with you, Sarah.
I would say the biggest item I would say for a recommendation is really just take the opportunity. If you're considering this, take the opportunity, as this is your time to really create consistency if it doesn't already exist in your business process. There are a lot of positives that are going to come from implementing a program like this. As we've already said, the cost savings, the reporting, the visibility and transparency of things across the board. But in order to achieve that, sometimes I know organizations will have a little bit of a struggle with each location or region wanting to do their own thing. Take the ability of partners like us to explain how data can enhance those business processes. And then we're happy to explain that to your teams to kind of just come to consensus, so that when you're building this, you're building something, as we said before, is scalable. So that would be my biggest advice, is considering this as a perfect time and a valid reason to develop that consistency across your organization.
I love
Well, I
that.
guess for me, my one recommendation, I'm going to just kind of reiterate what I said earlier. Be selfish. If you're a client, be selfish. Find out exactly what you truly want, what you think your deficiencies are, whether you're moving to a Gen 1 or you've got a program and you're unhappy. Be selfish, because again, I think where healthcare enterprises have not been on par with a lot of the Fortune 500 programs is that they're not being as bullish around what they want and wanting their MSPs to live up to their expectations, right? So be selfish. Really have a list of what you want and what you need, and hold your partners to that standard, right? Because again, it's your program, not your partner's program, right? So I think that would be my first recommendation when you go to RFX, or if you're out there hunting and pecking for a different mousetrap, is be selfish and understand what your specific needs are and your challenges are, and have the provider come to you with those solutions versus you having to come to them and meld your processes to their out of the box solution.
Awesome. Well, thank you both for those insights. We're going to jump into a little Q&A here. So we'll put the questions up on the screen here, and then Sarah, Eric, you guys can just decide who is the best one to take each of the questions. All right. So we've got, in what ways have you seen technology transform the travel healthcare landscape, and how does your organization leverage these advancements?
All right.
Well, Sarah, that's a travel healthcare question. That's right
yeah.
down your alley.
Our landscape. So I would say overall, there's a big need for we've already talked a lot about that reporting, but I think in terms of enhancements or how things have been leveraged is particularly in the acute care settings. There have been times where clients have to make that decision at the height of COVID, and sometimes other times where there's just been a huge demand, which necessitated really large rates. One thing that you would consider as well that you can bring into your program is taking a look at the census as well. So that's considering bed control. Now, what I like to explain to clients is really this is your choice. Each bed, on average, we're looking at what is that cost for that client, and we'll know that as your partner if it's $10,000 a day or $15,000 a day. And we say, okay, if that one med surg nurse isn't available, is that 5 beds that you're going to miss out on that 50+ thousand in revenue. And in other cases, if you're looking at the census and you're going, well, we're only at half capacity right now. We don't want to be in that place. I think that's something that's helped to kind of drive that per diem side of things. So that nurse float pool, can we cancel shifts? So I think that's been one of the biggest changes in the last 3 years is because it really wasn't as an arm twist before, but with the costs being what they were, people decided, should we close the bed? Should we not close the bed? So there's this heightened activity considering, just the full census. The other piece I would say, as far as a transformative item, really in the last 3 years. Now, EOR, employer of record, which is somebody came to you, and instead of you hiring them, we hire them, so that you don't have to manage onboarding and all of the W-2s and everything else. There's a number of reasons that companies choose to do that. And EOR does come at a lower price than a standard recruiting model. So that I had not seen as much in the healthcare space because, as I said before, people were just trying to keep it separate, do their own staffing teams, and then direct sourcing, which we also call talent community, which is the referral-based model, is also, I think, emerging in healthcare. Really had not been seen as much in the healthcare space, but the idea of that is that you take a seed community, which is maybe your active workers, your retired workers, silver medalists, where people that have maybe applied and didn't take the job in the past, and you start a talent community that not only are you sharing jobs, but you're just fostering this and cultivating this community with things about your organization. It is branded with your logo and your events and other news, and that is a referral-based model. So that model is also less than the regular recruited model. So I think some of the newest things that we're seeing, and in fact, LoyalSource is partnering with Flentis to be able to do this for organizations, is offer that low, medium, and normal set, which is the EOR. You found them. Referral based is kind of that middle spot, and then of course the MSP or recruited model is kind of that normal price. So those are really some of the things that are at the forefront. And if you think about it, the more that your referral base grows, or that you've gotten the word out and you have people coming to you on your own that are at those lower costs than recruiting, then you're not asking your partners for some type of discount. This is naturally bringing your costs down over time. So those are, I think, some of the biggest items I've seen that are new.
Awesome. All right, we'll take another question. I know we've got a couple here, so if we don't get to it, we're running up on time here. So if we don't get to it, we'll reach out to you individually. But we've got one here that says, I'm in the UK with an interest in clients running private and NFP's care homes. Is your software and dashboards applicable to such market?
Well, I mean, the immediate response is yes, but for an organization like Flentis, a VMS, we have some spend thresholds, right? So if there's a client that's only spending $600,000-700,000 a year in contingent workforce, then that doesn't really make sense. I mean, that's not something you really need a VMS for. But achieving that $5 million threshold in healthcare is not very hard. If you think about, completely loaded bill rates and then just volume on top of that, if the spend threshold's there, it doesn't matter the jurisdiction or the worker type. Yeah, it can be used in a wide variety of ways. So I just probably would need to learn a little bit more about the situation and the challenges ahead.
All right. And the last question we're going to take today, what significant trends are you observing that will be prominent in travel healthcare in 2024? Sarah, our travel healthcare expert here, if you want to answer that one.
Yeah, absolutely. So I think what we're seeing is that reemergence of per diem. So one thing that I would like to point out, really about something that we're working on, Flentis and LoyalSource, is when you think about the old per diem days, when I first got into this business, this meant that somebody would take a phone call at 5 a.m., 5 p.m., and it would be one of those things where you'd have to try to staff that. Now we have something that's able to generate that float pool. Flentis is one of those that has a unique item to be able to post per diem type needs in a scheduler. And then LoyalSource has an upcoming mobile application where our talent communities can see those per diem shifts, claim them, and it automates that process. So we've prepared for that for 2024. That is something I think many organizations were hoping would kind of stay far away, but we're seeing it not only from organizations that want to have less commitment on the contract side, but also workers that post-COVID have decided, you know what, maybe I don't want to travel as much. I'm going to work locally and I'll pick up shifts when I feel like picking up shifts. So you've just seen this shift of both parties, and you're going to see that adaptation. I also think, as Eric said before, we'll see a continuance of potentially this independent contractor group, and we will need to accommodate that in what I've just said about the talent community. So it's just looking at ways to still get the same community in non-traditional formats.
Mm-hmm.
Perfect. All right. So once again, if you guys asked a question that we didn't get to, we will reach out to you. Also, please feel free to reach out to myself, Eric, Sarah. We're happy to connect outside of this. And other than that, I really appreciate everyone joining. Sarah, thank you for being our guest this time. And we will talk to everyone soon. Happy holidays, everybody.
Thank you. Thanks, everyone.
Yes. Happy holidays.